This month marks Lung Cancer Awareness Month, a time to focus on early detection, risk factors, and the life-saving power of screenings. Joining us once again is Deanna from Omni Family Health to help us better understand lung health and what steps we can take to protect ourselves. Hello.
Hi, good to see you.
Great to have you back.
Thank you so much.
Don't tell everyone else, but you're one of my favorites.
Okay.
So let's talk about why it's important this month to, raise awareness about lung cancer.
Lung cancer is such an important cancer to bring awareness to everybody because it is one of the leading causes of cancer deaths worldwide.
Wow.
And I don't think it's one that gets a lot of popularity. Not that any cancer is popular, but it's just one we don't think about a lot. But leading cause of cancer worldwide. And so we really want to start talking about it more so people have it in their minds. They start thinking about getting screened, which could potentially save their life.
And I think a lot of us really just associate lung cancer with smoking, but there are other risk factors that people should be aware of, right?
There are, yes. Of course, smoking, 90% of lung cancers are going to be caused from smoking, but secondhand smoke is a big risk factor as well. And people may think I'm smoking outside, it's going to be fine once I come inside, my family's safe, but they're not. Any residual from the clothing that's there is still going to expose your loved ones to secondhand smoke, which will increase their risk.
And that secondhand smoke's worse, right, than even firsthand smoke?
Terrible for you. Yes, really, really bad for you. A couple other things can increase your risk factors. Of course, just healthy lungs overall, right? So if you're not moving, you're not exercising, age with time, you're automatically going to have an increased risk factor will go up. Air pollution, we think about our area and air pollution, even radon gas, something we don't hear a lot about, but it just seeps up from the ground. We can't see it, we don't smell it.
Wow.
So it can be kind of scary because you don't even realize it's there, but it's one of the biggest risk factors.
Now, I know a lot of these cases tend to get diagnosed later, so what are some of the early warning signs that we should be on the lookout for so we don't end up being diagnosed too late?
That's a great question. So maybe just a mild cough that won't go away. I just have this cough, it won't go away. Or shortness of breath. Certainly, if you're coughing up blood, anything like that, do not ignore it. Come in so that we can check you. Some things, though, may have no symptoms at all, and so that can be really scary, too.
So let's talk about screenings then, because if you're asymptomatic, getting screened is even more important. So who should be considering getting screened?
Exactly. That's the whole point, right? So come in to be screened because you might not have any symptoms at all. So early screening is going to be so important for our patients. We're going to send them to do a low-dose CT scan of their lungs. Certainly if you're over the age of 50, if you have a history of smoking, family history of lung cancer, those are the folks we want to come in and talk to us about getting screened.
Now, say somebody is diagnosed, what do treatment options look like today?
So treatment options have actually evolved quite a bit. There's a lot of new therapies. There's targeted therapies where they're just looking at that one problem spot, immune therapies. The treatment options have changed quite a bit, and it's really giving a lot of hope for our patients.
So at Omni specifically, obviously we're doing the screenings, but are you also helping patients who are currently battling lung cancer on their journey?
Yes, totally. At Omni Family Health, we help patients from prevention all the way to recovery. We know that prevention is so important, and so if somebody's a smoker, we want to help them quit. We're going to talk to them about prescription medications, nicotine patches, oral medications, even behavioral health therapies to help with those addictive personalities. So we'll help with them with the prevention. Of course, we're going to get them screened, and then if somebody is diagnosed with lung cancer, we're going to make sure they get into the hands of the specialists, and we're going to support them the entire way through.
But step one is getting that screening, right?
Exactly.
So how do people reach out to get a screening?
Come in and see us at Omni Family Health. You can call us. You can find us online. It's easy to make an appointment, and we will get you seen by one of our healthcare professionals.
I love that you can call or text. It's just so easy.
Yeah.
So there's no reason not to, friends.
Exactly. Easy.
Well, thank you for joining me again today.
Absolutely.
All right, with that, we're going to take a short break, but we'll be right back.